My name's Woolridge, as you can see from the slide. I have several hats. I'm in a consultancy, but I'm not here in any consultancy capacity today. But one of the things we do, you may know my name through NHS E&I, because I'm a technical lead for the logistics cell working through estates and facilities. So while we've had clinical waste problems over the last, well, I would say 3.5 years, it started with the failure of a clinical waste contractor, and then more recently went into COVID, where pretty much the NHS broke the clinical waste system completely. Totally overwhelmed it. We used to do about 213 tonnes a day of waste out of the healthcare sector. That includes dentists, podiatrists, opticians, but acute and primary care as well, mental health, ambulance sector. At the peak, this time last year, we were doing about 630, 650 tonnes a day. So we put three times the amount of waste out on a daily basis. That got extended across wider than that, not just the UK. So in addition to the NHS work we do as one of our clients, I'm also the UK Health Security Agency's scientific advisor on waste. So all your lateral flow devices, all the PCRs, and then I have a voluntary role with the International Solid Waste Association, who are in what they call an official relation with the World Health Organization. So I've broadly been working voluntarily with the WHO since Ebola in 2014. So what they've got is a team of nominal experts who pull together to write guidance very, very quickly. Peer-reviewed, we work with Bruce Gordon, we work with the WASH team, we work with Infection Prevention Control, but we're only working with the waste, because it tends to be the bits that everybody forgets. So what we did with the COVID-19 is ISWA was invited as one of the partners to join up with the World Health Organization to have a look at how we were going to manage the waste. Because at the time, nobody was sure of transmission routes. Going to give you a little bit of information about the International Solid Waste Association. It is a leading network in promoting professional sustainable waste management and resource management. It's not just about the waste, it's also about the resources. It represents all stakeholders, so it represents waste producers, it represents people that manufacture, it represents educators, it represents consultants. What it does, it brings all these disciplines together at a global level to look at waste. So we're a logical set of people to go to work with the World Health Organization. Members in 109 countries, which when you come to pull together a piece of global advice, it's really handy to have those people who say, well, the problems I've got are this, and the problems I've got are that. So we have had that global input. We've also worked with some other partners. I'll come on to that in a minute. So this report came about because there was a need for guidance to dispose of waste at a global level. Waste that we didn't really know whether you could get COVID from it, whether it's transmissible for SARS-CoV-2. Fortunately, sort of by March, July time, the research started, sort of back end of 2019 into 2020, early 2020. But by the middle of the year, we were pretty confident that you weren't going to get COVID from waste. And I know as infection prevention professionals, we're all about the surfaces, we're all about touch points, and we're all about hygiene and keeping things clean. That's why we're sitting the health and sanitation team. But from a waste management perspective, there are more videos of me going, other pathogens are available. Because from a waste management perspective, you're unlikely to get something that's respiratory. But you're highly likely to get HIV or hepatitis. Not in this country, but where people are actually handling waste, picking waste, don't have proper waste management systems in place. So we are looking specifically at what happened in the context of COVID-19, but we've always had at the back of our minds that there are other pathogens. So the report itself it was meant to be launched in November. It's 44 pages. It's a bit technical, but it's a reflection, but it also has recommendations in it as well. It garnered an incredible amount of media interest, at which point they were going to launch it. The media went into an absolute frenzy. So it then went back to the lawyers who said, I think we'll just check it again for legal. So it had its final launch on the 1st of February this year, where I hosted the webinar. But the recommendations in that are quite key, really, as we start to move forward and look at healthcare waste at a global level. We had an informal partner group that was broadly led by the UNDP. We had the Global Environment Fund, they are a funder. We had the Secretariat of Basel, Rotterdam and Stockholm Conventions. One of the things that waste is heavily affected by is conventions and protocols. So those conventions are key. Healthcare Without Harm, who some of you may have heard of, their scientific advisor resides in the UK, she's in the southwest, Ruth. They are understandably anti-plastic and anti-incineration. We had a lot of waste. We had a lot of plastic. So there were some challenges around that. UNICEF were one of the first people to come to the table on this one. Stop TB. Not necessarily a logical partner, but another respiratory pathogen. So they've got information that they were happy to bring to the table. The Global Fund. In Geneva, there's a building, and it's USAID, UNITAID, Gavi, the Global Alliance, and also the Global Fund all occupy the same building. I had just come off the back of a project working with the Global Fund, looking at building waste management infrastructure into their funding protocols. What I'd also done, and talk about fortuitous, I just learned all about the about rapid tests, so rapid diagnostic testing, which we would now know as our lateral flow devices, what they were made of, how to dispose of them, and also small-scale PCR testing and the chemicals and chemical disposal. So that was the ISWA contribution. MSF, the practitioners out in the field. Riders for Health, and I'll come on to what they did in a minute. Riders for Health were awesome, because they basically put a reverse logistics in. They were taking supplies out and bringing waste back. UNIDO and the CDC. So you can see it's a collective of organisations, but all work together, various ministries of health from different countries and other parties that had these formal relations. So the World Health Organization in this context, so we had Mike Ryan as well, who was there, sort of supporting us. Sorry, I think it's my hair. Sorry, I was like trying to work out what was happening. So what were the immediate needs? The immediate needs were to get PPE out. We had to get PPE to people. So there was a global portal set up for the supply of PPE, and I'm only talking here about the stuff that was actually logistically done through WHO. So there was other voluntary organisations and other people, but we're just looking at those from the 7 UN major partners. By looking at supply, we knew that we had put out an extra 87,000 tonnes of supply between March 2020 and November 2021. So that's not in the context of the UK. I'll sort of leave the UK behind for a bit. But we had systems that were under stress before the pandemic. We had systems, we have countries that don't have proper healthcare waste management before the pandemic. So suddenly we're dealing not only with poor infrastructure, but also a massive influx of extra stuff that they're not used to dealing with. The other challenge was getting it there. Because I'm sure if you cast back to 2020, commercial flights stopped. We didn't go on holiday. We weren't shipping stuff around. So in order to get a lot of these PPE supplies, and latterly the vaccination supplies, to get a lot of the PPE supplies out there, had to piggyback onto piggyback onto the United Nations Food Programme. So where we've got food drops in country, we're now dropping PPE as well. So we're dropping all this stuff, but we still haven't given them away to get rid of it. So the environment we'd already had, and I don't know how many of you are in NHS trusts that declared a climate emergency. Some of the ambulance sectors have, some of the NHS trusts have, Great Ormond Street have, so there are trusts that have declared climate emergency. And that climate emergency didn't stop just because we were under the stress of a pandemic. 3 out of 10 health facilities globally, and I don't include the UK in this, but don't have the systems to even segregate their waste, let alone send it somewhere. We have climate change exacerbating challenges, particularly if you think back to the forest fires. We have drought, we have fire, we have flood. So all these have an impact on healthcare waste as well. Some of the Asian cities, the way they classified their waste, they were getting 10 times more waste out. We were getting 3 times more. They were getting 10 times more waste out than they were before. with nowhere to send it. What the Indian government did is said, okay, anybody that is generating biohazardous waste, which will be everything, by the way, because we're not letting you segregate out anything that's domestic. You're going to call it all healthcare waste if you've come into contact with SARS-CoV-2 and patients with COVID-19. You're going to have an app. So the Indian government said that anybody that's creating biohazardous waste has to use this app. So then they started recording stuff they'd never recorded before, because they didn't record the healthcare waste before, because they just sort of got rid of it with everything else. So it started to put real pressure on the system, because now it's a bit like be careful what you wish for. Because they were like, we want the data. Oh my goodness, what was happening before? Nothing. So 4 to 5% of global greenhouse gases come from the delivery of healthcare, not the waste, the delivery. So that's supply, that's infrastructure, people getting to and from work, patients getting to and from hospitals, anaesthetic gases. So healthcare is a big global emitter. It's up there with aviation. Good healthcare waste management is absolutely the key to reducing this. There is a piece of research that's been carried out by the Royal Academy of Engineering, and it's looked at the health disbenefits of poor waste management across all sectors, so including WEEE and everything else. But one of the big problems is a lot of healthcare waste still gets open burned. Because people think it's dangerous, which it is, or can be, so they burn it. But then we've then got to look at the poor health effects of people exposed to burning waste. Particularly when you look at what we've got in pandemic waste, when we look at what was supplied for SARS-CoV-2, because what it is supplied? Visors, plastic, masks, plastic, gloves, type of plastic. So all these plastics are now getting burnt and then putting emissions to the atmosphere. So one of the questions that they looked at was, is this PPE actually necessary? Was it all necessary? Did we need all that PPE? So what the WHO have done is gone back and had a look at what was necessary PPE and what wasn't to inform future pandemics. I know as IPC there's been massive debates about what PPE you need, what levels of PPE, but when you look at it, this is a global level as well, it is really important. They had essential use. One of the things that they also did look at much quicker than we have here is reusables. Because again, cleaning standards, and I know that Emma's doing her, the cleaning next door, but cleaning standards are probably different. But we know that people were reusing single use anyway, so WHO made a decision to supply properly reusable things that could genuinely be decontaminated, rather than people wearing the same single-use mask days in, days out. I wrote this about 4 weeks ago, this presentation, and at that point, before a lot of the restrictions were lifted, we were disposing of 3.4 billion single-use face masks a day across the world. That is a lot of plastic. We have information about the procurement of gloves and masks, either pre-pandemic or post-pandemic, pre-pandemic and then into the pandemic, and you can see the volumes of gloves and masks that were shipped by region. I think this presentation is actually available. There's a version of it on the internet anyway if you need it. One of the problems we had was classifying the waste. So normally, WHO say that 10 to 15% of your waste from general routine healthcare, and that includes in the UK, 10 to 15 should be waste that requires special treatment. So it's either infectious or it's pharmaceutically contaminated or it's sharp. When we started to look at the disposal of the waste from early pandemic, everything went. I have photographs in the UK of boxes of oranges in orange bags. I have all the cardboard boxes that the oranges came in cardboard bags. I've got all the supply into wards and departments, even into hospitals, all coming out as infectious clinical waste. And basically, other waste streams were turned off. I sort of understand that, but again, we've still got to look. And I know from IPC, I am not, IPC, you are going to treat everybody as a potential reservoir of bugs, regardless. That's absolutely fine, because the universal and standard precautions say, assume somebody's infected until you know they're not. From a waste management perspective, it's the other way around. waste management, the regulations say unless you know or reliably believe that that waste contains pathogens or their toxins, it's not infectious waste. So you might have an infectious patient or somebody you think potentially infectious, but it doesn't mean the waste is infectious. And that's what we were working with. So this SARS-CoV-2 is an enveloped virus, as you know, inactivated relatively quickly, particularly when exposed to heat and light. The WHO has indicated normal procedure should apply. So we sent enough biohazardous bags out there to cope with 61,000 tonnes of waste. But I've already said we've supplied 87,000 tonnes of waste. So not enough bags got sent out. 87,000 tonnes of stuff that was going to be used in a clinical environment to be treated as waste. So what has happened to that? Probably got put into other things. This is a photograph from UNEP. A guy called Jorge Emanuel has done a massive amount of work in writing guidance as well. He is a brilliant photographer and manages to just capture, for me, this photograph is like, we've got to do something. Testing wastes. So globally, when I wrote this, we had done just under 6 billion tests. It's a lot. It's a lot of waste. We shipped about 140 million from the United Nations. And with the PCR waste as well, we have looked at up to 731,000 litres of chemical waste that contains a chemical guanidine isothiocyanate, or guanidine thiocyanate, depends which ISWA you're looking at, that is an ecotoxin. Because if you think about it, if it's going to split the RNA of the virus so that you can have a look at it and you can replicate it, it doesn't go, oh, I can only do that to SARS-CoV-2. It'll do it to anything. So you get that in your water courses, you've suddenly got an ecotoxin as well. So currently, 97% of the plastic from these kits are incinerated. As I said, I'm the scientific advisor on waste for UK HSA. And all I keep saying is, we need to stop making waste. We need to redesign these things so that maybe we only put the little strip in and we can recycle the rest. But we've got to start looking at different design for this. Vaccination waste. This, I think, it's been a challenge for the UK in terms of adding extra sharp spins and things. But we've given 11 billion doses of the vaccine globally. But I think the thing that possibly gets missed here is we would normally give 16.2 billion vaccinations per annum anyway across the world just prophylactically. So when you start to look at other countries across the world, Gavi, the Global Fund, Stop TB, they will be giving these injections anyway through their UNDP partners. So we do think that we have generated about 80 million sharps boxes, 90,000 tonnes of glass vials, 50,000 tonnes of needles and syringes, and 10,000 tonnes of sharp spins. So even the sharp spins themselves have become a waste, and there's 10,000 tonnes of those. Now, some of your hospitals will be using reusables. I have to say I've been to quite a lot of vaccination centres and I haven't seen reusable sharp spins in the vaccination centres. They all seem to have gone down the single-use route. One of my questions here to you is WHO guidance. And I think some of the NHS guidance doesn't say wear gloves for vaccination. It says you don't need to wear gloves for vaccination. Is that correct? But everybody did. Not everybody, but a lot. And do you know why? Because you were driven by the media to an extent. The media said, and I saw first of all, they didn't get the colours right on a lot of the bins in the papers, but there was a vaccinator doing her thing, and it was a lady in that case, vaccinating this person, and it wasn't the first lady, wherever it was. And the first thing you got on the comments on one of the very popular smaller newspapers that has a bit of negative view on everything, went, called you out, she wasn't wearing gloves, dirty. There's no requirement to wear gloves to do vaccinations. But the perception through COVID was, well, we'll wear our blue gloves for everything. We'll wear them to go shopping. You know, everybody that wouldn't have worn blue gloves is wearing blue gloves. not even in a clinical environment. So that was one of our big challenges. It wasn't you as practitioners, because you know it should do it. It's everybody calling you out for not doing it. And hand hygiene, and I think we've heard that so many times, but hand hygiene is key. So that is one of the big things I now plan to do. Going forward, I plan to start to try to educate the media. Because by the time we can educate the media, we can educate public health. So somebody should have come back and said to that commenter, not necessary. But no, it just snowballed and got bigger and bigger. We do need to be innovative. We do need to reduce the amount of unnecessary PPE through safe and rational use. And I'd say this is at a global level. I'm not just talking about the UK. We need better packaging. We need to develop easy disinfectable and reusable PPE. For anybody that was in Paul Shiver's session yesterday, there is a PPE innovation hub. It's still going, because just because we're coming off the back of this, we've got to be planning for the next time. We need to look at the polymers that things are made of. We need to design for end of life, again, globally. And if we put a global back into this, we should be able to do something. Implement reverse logistics, as I was saying about Riders for Health. They took supplies out, but they brought waste back to a central point. So it wasn't just abandoned, it wasn't fly-tipped. We do need to look at non-incineration technologies, and while incineration countries, incineration with countries that have regulation that say that you must make sure that you've got abatement systems in place, your gas must be cleaned before it comes out, you've got to have permits, you've got to get your air checked, everything else, that's fine. It's the open burning that's the problem. And we also, and this is one of the recommendations out of the report as well, we need to invest in local manufacture, local production, because so much of the stuff was just shipped around. So just to start summarise really, the recommendations were global. It was really interesting. We had the World Bank turn up at one point. As I say, we've got Jeff in there, we've got the Global Fund. We need to ensure that health donors don't just understand how to get the money out there. They need to understand IPC. They need to understand waste management. And they need to make the funding available to support that infection prevention and control and also waste management. It is not just about supplying the goods out. We need to look at the whole life cycle. We need to support behaviour change away from single use. There will always be a place for single use for some things, but we have to start looking at that. Is there a way we can make things last longer? And I think the plastics bill, the NHS's target to remove single-use plastics will have an effect. It will innovate by necessity. And we need to, say, look at prioritising regional and national PPE manufacturers and shipping. Because at one point, most of what was being moved around the world was PPE. But it was moved from places that made it to places that also made it, but they were making it, but moving it somewhere else. Well, why didn't they keep theirs when they keep theirs? So we need to start looking at that supply chain. National recommendations, again, looking at healthcare, waste standards and practices, investing in healthcare waste management at a local level. The WASH team, the Water, Sanitation and Health team, did a phenomenal amount of work on this because they were able to piggyback on some of their prior work, but it's really consolidated a lot, but we do need to make national changes. We need to make sure that there's national legislation and infrastructure, because in some countries that's not there. Include waste management in health budgets. It's very easy to just think, well, I'm all about wellness. You are, and you're preventing ill health. You are, but waste management is still part of that as well. Regularly monitor and report on healthcare waste practices. And again, look at what is the most sustainable. At a facility level, so literally down at facilities, we need to improve training, mentoring and investments for safe and sustainable waste management, and also invest in people. Because it was so easy to probably go, actually, I don't do waste. I don't do waste either. Well, I don't do waste. Well, I've now got loads of waste. Because we were just ending up with piles of it because nobody was actually wanting to manage it. So it is about that education. And we need to look at the sustainability of waste treatment technologies. Because it's no good saying, I've got an amazing autoclave. I'm just going to pop my amazing autoclave in the middle of a desert. where I don't have electricity and I don't have running water, so I can't. I've got to make sure I get technologies that are appropriate. If it's solar won't generate the power that we need, it won't generate in the steam levels, but now we're starting to be able to convert solar better to electricity, we need to start making those sustainable changes. Here's some quotes from partners. So Dr. Mike Ryan, he's absolutely vital to provide health workers with the right PPE, but Mike Ryan is also making sure that we can manage the waste and the environment. Mandeep Diwali, she's Director of HIV. Again, waste management is an integral part. Ruth Stringer from Healthcare Without Harm, in the face of COVID-19, sustainable healthcare waste is more important than ever. I also had a quote, and well, I mean, I contributed to writing the report, but in the press release, it's got a systemic change in how healthcare manages its waste would include greater and systematic scrutiny and better procurement practices. And I class that globally, including the UK. I think we need to look at that. We do need to ensure that health investments take into account that entire life cycle. What are you buying? Why are you buying it? How are you using it? How are you disposing of it? Is it safe? Is it sustainable? Thank you very much.